Begin the procedure by reading the physician's order in the patient's chart. Review for discontinued, suspended, or new medication orders. Explain the procedure to the patient. Introduce yourself and explain the procedure as to the nature of the drug, effects to expect, and in towards symptoms to watch. And proceed to hand washing. Dispense cotton balls, syringe, and needles. Prepare cotton balls on jars and wet one jar with 70% isopropyl alcohol. Notice how the back of the cotton ball is open. Transfer the cotton balls to the jar. Of the 5 packs of cotton balls, 3 of which are for the wet and 2 for the dry. Next procedure is dispense the syringe and needles to a stock tray. Observe the aseptic technique in opening and dispensing the syringes and needles into the stock tray. Arrange the needles and syringes according to its use. Next procedure is to perform flaming. Using the calicurve, clamp 1 tray cotton balls and place it into the injection tray. In performing the flaming, pour the denatured alcohol over it while placing palm against the label of the container. Then ignite the soaked cotton ball, pass flaming cotton ball over the injection tray in one direction, Prepare the injection towel. Make sure that the folding part is the right for the injection towel. Then do the first reading. Sterile water, sterile water. Place the following items on the sterile towel: 2 dry cotton balls, the tuberculin or the 1cc syringe gauge, 23 needle, and the 5 wet cotton balls. Also, don't forget to place 1 wet cotton ball on top of the vial. Disinfect the rubber cap of the vial from the top to bottom using wet cotton balls, and also disinfect the hands. And then do the second reading. Sterile water, sterile water. Attach the aspirating needle to the syringe. Aspirate air equal to the amount of the medication you will withdraw from the vial. Air has to be injected into the vial prior to aspirating 1 ml of sterile water. The amount of solution aspirated has not reached 1 ml, thus we need to aspirate more until such time we obtain 1 ml of solution. Pull the plunger down and change the aspirating needle to the gauge 25 for injecting. Needle pulling the plunger down prior to changing the aspirating needle. Avoid wastage of the medication. Align the bevel of the needle to calibrate the syringe using the calator and recap the needle loosely and return back to the syringe towel. Next is do the third reading. Sterile water, sterile water. And then insert the medicine ticket under the sterile medicine towel and the level with syringe and prepare alcohol swab. Identify the patient identity using by at least 2 verifiers. Considering the patient is conscious, ask the name, date, and how old he or she. Place the patient in a comfortable position. Palpate skin for induration or tenderness. Remember that ideal injection site must be free from scar, mole, lesions, wound, rashes, or any other disturbance of tissue's growth. Or a possible injection site in the inner forearm is between the hand's width above the wrist and 3 of the 4 fingerprints below antecubital space. Next is disinfect the injection site using alcohol swab from inner to outer motion. Hands disinfect with wet cotton balls also. Wear gloves and place 1 cotton ball between left small finger and ring finger. Support and grasp the forearm from the underside, stretching the skin. Hold the syringe and place needle with the bevel side up at 15-degree angle against the skin. Insert needle point into the skin until the skin introduces medication slowly and gently to create a bleb or wheal. About 1/2 centimeter in diameter, withdraw the syringe. Do the technique of 1-hand scoop method. And do not press or massage. Instruct the patient to not apply pressure. Subcutaneous injection. First thing we need to do is do the first reading. Sterile water, sterile water. Refill the injection towel with aspirating needle. Inject the needle under wet cotton balls. Notice that there were 3 wet cotton balls left in the injection towel, so you only need to add 2, then place the wet cotton balls on the top of the vial. Disinfect the vial using the wet cotton ball. After disinfect the vial, also disinfect your hands. Next, do the second reading. Sterile water, sterile water. Since the gauge shrink to 3 for aspirating needle is no need to change at this point. Instead, proceed to aspiration of 0.5 ml air and inject the vial. Aspirate 0.5 ml of the medication, pull the plunger down and change the needle. Align the bevel and the calibration. Return the syringe to the injection towel. the third reading. Sterile water, sterile water. Identify the patient accordingly using at least 2 verifiers. Then explain the procedure. The next procedure is disinfect the injection site. Using an inner to outer motion, disinfect also the hand and also wear gloves. Prepare cotton ball and syringe. Grasp the subcutaneous portion of the skin and subcutaneous tissue between thumb and finger of the non-dominant hand. With the right hand, hold syringe in 1-on-1 and inject. Then check for bleeding and possible reaction or complications. And then use one-hand scoop technique to recap the injection. Do the first reading. Sterile water, sterile water. For the intramuscular injection, refill the injection towel with a needle and syringe and wet cotton balls. Place one wet cotton ball to the vial. Disinfect the cotton ball by top to bottom. Do the second reading. Sterile water, sterile water. Since the gauge 23 or aspirating needle is already attached to the syringe, there is no need to change the needle at this point. Instead, proceed to aspiration of 0.5 ml air and inject to the vial. And then pull the plunger down to change the needle. Do the third reading. Sterile water, sterile water. Identify the patient accordingly, at least 2 verifiers, and then explain the procedures. Assess the patient in assuming that lateral position with knee flexed as the site of the injection will be ventral gluteal. Locate the injection site guided by the landmark. Place the palm over the greater trochanter, the index finger towards the anterior superior iliac spine, and the middle finger to the iliac crest. Take note that to locate the ventrogluteal injection site, the nurse's right hand is used to be located the landmark on the patient's left leg, and vice versa. Is the injection site draped the patient? Disinfect the injection site inner to outer motion. Place ulnar side of the left hand and grasp the tissue using the thumb and index finger with the right hand. Hold the syringe between thumb and forefinger. Inject needle quickly into the tissue to 90 degrees angle. Aspirate to check if the needle is not on a blood vessel. If blood is not drawn, inject the medication slowly. After the injecting slowly, press the side with a cotton ball. Withdraw the needle quickly.